So we have a case of 46-year-old woman who has progressive dysphagia to the solids. She is also complaining of the fatigue, long-standing fatigue, and there is angular stomatitis, which is generally seen in the deficiency of iron. Iron deficiency anemia, you see angular stomatitis, you also see glossitis. And in the endoscopy, you see thin membrane structure in the upper esophagus, which is basically a web. So whenever you see three things, that is iron deficiency anemia in the form of long-standing fatigue, angular stomatitis, or even in the investigation, for example, if the patient has low serum iron and if the ferritin is also low, TIBC is low, and transferrin saturation is low, TIBC is high. In this condition, you have to think of iron deficiency anemia. Now, this case has an iron deficiency anemia. Along with, we have iron deficiency anemia. Along this, we have Webb, and so there is also dysphagia. So this is a clinical triad of Plummer Vinson syndrome. Plummer Vinson syndrome, where you see iron deficiency anemia, dysphagia, and Webb. So the question is asking what is the most accurate statement regarding her future cancer is. So please remember that Plummer Vinson syndrome is a risk factor for squamous cell carcinoma. The reason is whenever in the esophagus the food particles accumulate, they make lactic acid. This lactic acid, along with the mechanical stress, causes continuous irritation of the esophagus wall and lead to the development of squamous cell carcinoma. Please remember, it is not a risk factor for the adenocarcinoma. It is a risk factor for squamous cell carcinoma. Also, similarly, there is Jenker's diverticulum. Jenker's diverticulum is basically outpouching in the post-cricoid area of the esophagus. It is also a risk factor of squamous cell carcinoma. So this is basically a squamous cell carcinoma risk factor. So we have Plummer. So question is asking, so she is a higher risk of adenocarcinoma? No, it is not a risk factor for adenocarcinoma. The risk factor for adenocarcinoma is obesity and Barrett esophagus or chronic GERD, gastroesophageal reflux disease. So this is not the answer. Squamous cell carcinoma of the middle third. Yeah, most common site for squamous cell carcinoma is middle third. So this is the answer. Then option C is risk of carcinoma is mediated primarily through the Barrett esophagus. No. Through Barrett esophagus, the risk factor is for the adenocarcinoma. Adenocarcinoma may arise? No. Malignancy is unlikely? No. It is a risk factor for the malignancy. So please understand, Plummer-Vinson syndrome is a triad of dysphagia, Webb and iron deficiency anemia, and it is a pre-malignant condition, can cause squamous cell carcinoma.